Question 1. What is the main goal of conducting a preference assessment? A. To teach new skills. B. To find out which items or activities a client likes. C. To decrease unwanted behaviors. D. To punish inappropriate behavior. Answer. B. To find out which items or activities a client likes. This question is about preference assessments, and the keyword main goal helps you focus on understanding its purpose. It's not about stopping bad behavior or teaching something new. A preference assessment is when you offer different choices to see what the client enjoys most. Knowing what they like helps us pick good rewards that make learning and good behavior more fun and motivating. It's not designed to fix bad behavior. It's simply about discovering what motivates the client. For example, if a child loves blowing bubbles, you can use bubble time as a reward for finishing a task. Here's an easy way to remember it. Preference assessments are all about finding what motivates the client, not trying to fix their behavior. Question 2. When a client touches a picture of a shoe after the RBT says, "Touch shoe," this is an example of which type of verbal behavior? A. Tact. B. Manned. C. Intraverbal. D. Listener responding. Answer. D. Listener responding. This question asks about a type of verbal behavior where the client is following an instruction given by someone else. The clue is after the RBT says, "Touch shoe," which means the client is responding to a verbal cue by performing an action. Touching the picture. This isn't labeling. Tact. Asking for something. Mandy, or having a conversation. Intraverbal. It's about understanding and acting based on what someone else says. For example, if you tell a friend, "Pass the salt," and they hand it to you, that's listener responding. A good way to think about listener responding is simply following directions. Question 3. Which of the following describes continuous measurement? A. Measuring behavior only during specific time intervals. B. Measuring behavior every time it occurs. C. Measuring how long a behavior lasts. D. Measuring the time between responses. Answer. B. Measuring behavior every time it occurs. This question tests your understanding of continuous measurement methods. The key idea is that you are tracking every single instance of a behavior from start to finish within the observation period. Methods like frequency, counting every time, and duration, measuring how long each instance lasts, are types of continuous measurement. Options A, C, and to describe other measurement types like discontinuous measurement, interval recording, duration, only one specific continuous method, and latency, time between cue and response. If a child claps their hands, continuous measurement would count each clap or measure how long they clapped for the entire time you were watching. Remember, continuous means you don't miss any occurrences of the behavior you're tracking. Question 4. What is the primary role of the registered behavior technician, RBT? A. To design behavior intervention plans. B. To supervise other RBTs. C. To implement behavior plans designed by a supervisor. D. To conduct diagnostic assessments. Answer. C. To implement behavior plans designed by a supervisor. This question is about the specific job responsibilities of an RBT. The most important thing to know about the RBT role is that it's primarily focused on carrying out the treatment plans. RBTs work directly with clients, using the strategies and goals that a board-certified behavior analyst, BCBA, or other qualified supervisor has created. They don't create the plans themselves, supervise others, or diagnose conditions. Think of it like being the person on the ground, putting the plan into action, while the supervisor is the architect who designed it. Your main job is to follow the instructions precisely. Question 5. If a client gets a sticker every time they put a toy away, this is an example of A. Punishment. B. Extinction. C. Reinforcement. D. Prompting. Answer. C. Reinforcement. This question asks you to identify a basic behavior principle. The key here is that a desired consequence. getting a sticker, is happening after a specific behavior, putting a toy away, and it is likely to make that behavior happen more often in the future. This is the definition of reinforcement. Punishment would decrease the behavior. Extinction would involve withholding reinforcement to decrease the behavior, and prompting is giving a hint before the behavior. Since the sticker is given after the behavior and is meant to increase putting toys away, it's reinforcement. Think of reinforcement as anything that follows a behavior and makes it more likely to happen again. Question 6. Which of the following is not a method for conducting a preference assessment? A. Asking the client or caregiver what they like. B. Systematically offering choices and seeing which are chosen most often. C. Observing what the client chooses to engage with freely. D. Using punishment to see which items the client tries to avoid. Answer: D. Using punishment to see which items the client tries to avoid. This question asks you to identify something that is not a way to find out what a client likes. Preference assessments are all about discovering what motivates someone, usually by watching, asking, or directly testing items. Options A, B, and C are all standard ways to gather this information. Asking is direct, offering choices is a test, and observing is indirect but informative. Using punishment, option D, is about decreasing behavior, not finding out what someone prefers. It's completely unrelated to figuring out what a good reward might be. Remember, preference assessments are positive tools for discovering motivators, not using negative consequences. Question 7. A graph showing the number of times a behavior occurred over a period of time is typically displaying which type of data? A. Duration. B. Latency. C. Frequency. D. Interresponse time, IRT. Answer: C. Frequency. This question asks about the type of measurement used when you are simply counting how many times a behavior happens. The clue is number of times and occurred. Frequency measurement involves counting each instance of the behavior. Duration measures how long the behavior lasts. Latency measures the time between a cue and the start of the behavior. And IRT measures the time between two occurrences of the same behavior. If you counted how many times a student raised their hand in class, that's frequency data, and you'd likely show that count on a graph over different days or sessions. Frequency is just a simple count. Question 8. When should you report a significant change in a client's behavior to your supervisor? A. Only during scheduled supervision meetings. B. As soon as possible following company policy. C. Only if the behavior is dangerous. D. At the end of the week. Answer: B. As soon as possible following company policy. This question is about your professional responsibility for communication as an RBT. Significant changes in a client's behavior, whether positive, like a new skill appearing, or negative, like an increase in challenging behavior or a change in moody, need to be reported promptly. This allows your supervisor to make necessary adjustments to the plan, ensure safety, or communicate with the family. Waiting for a scheduled meeting or only reporting dangerous behavior isn't sufficient. Your company will have specific procedures, but generally, urgent changes require quick communication. Think of it as giving your supervisor a heads up so they can stay informed and make decisions. Question 9. A prompt is A. Consequence that follows a behavior. B. Reinforcer delivered after a correct response. C. Stimulus added before or during a response to increase the likelihood of a correct response. D. Method for reducing unwanted behavior. Answer: C. Stimulus added before or during a response to increase the likelihood of a correct response. This question asks for the definition of a prompt. Prompts are like helpful hints or nudges given before or as a client is trying to do something, to help them do it correctly. They are designed to make the correct response more likely to happen. Options A and B describe consequences, reinforcement, and option D describes behavior reduction strategies. A prompt comes before or with the behavior you want, not after it. For example, if you ask a child to point to the color blue and gently guide their hand towards the blue object, that hand-over-hand guidance is a prompt. Prompts help the learner get it right, so you can then reinforce them. Question 10. What is the purpose of a behavior intervention plan, BIP? A. To list all the client's favorite items. B. To provide a detailed guide for how to decrease challenging behaviors and increase appropriate behaviors. C. To summarize the client's daily activities. D. To document session attendance. Answer B. To provide a detailed guide for how to decrease challenging behaviors and increase appropriate behaviors. This question is about understanding the function of a behavior intervention plan, or BIP. A BIP is essentially a roadmap created by your supervisor to address specific behaviors. It outlines exactly what to do before, during, and after a challenging behavior occurs, as well as how to teach and reinforce more appropriate behaviors. It's not just about preferences or scheduling or attendance. It's your detailed instruction manual for managing and changing behavior. Think of the BIP as your playbook for helping the client replace challenging actions with helpful ones. Question 11. When an RBT says car when seeing a car, this is an example of which type of verbal behavior? A. Tact. B. Manned. C. Intraverbal. D. Listener responding. Answer A. Tact. This question asks you to identify a type of verbal behavior. The key here is that the verbal response, car, is controlled by something the person is seeing or experiencing in the environment. Seeing a car? This is the definition of a tact, which is essentially labeling or naming things, actions, properties, etc. that are present. A manned is asking for something. An intraverbal is like having a conversation or filling in the blank, and listener responding is following directions. Since the RBT is naming something they see, it's a tact. Think of a tact as saying what that is. Question 12. A client used to scream whenever they wanted attention, and the RBT would immediately go over to them. The supervisor decided that the RBT should now ignore the screaming, as long as it's safe. What behavior change procedure is the supervisor likely trying to implement? A. Positive reinforcement. B. Punishment. C. Extinction. D. Shaping. Answer C. Extinction. This question describes a scenario where a behavior, screaming for attention, is no longer being followed by the consequence that used to maintain it, RBT attention. When you stop providing the reinforcement that was making a behavior happen, you are implementing extinction. The goal of extinction is to decrease the behavior. Positive reinforcement would increase the behavior. Punishment would involve adding an aversive consequence or removing a pleasant one to decrease the behavior. And shaping is about teaching a new behavior gradually. By no longer giving attention for screaming, the RBT is trying to extinguish the screaming behavior. Extinction is essentially cutting off the payoff for a behavior. Question 13. What is the purpose of collecting data on client behavior? A. To provide something for the RBT to do during the session. B. To prove that the RBT is working. C. To make informed decisions about the client's progress and treatment plan. D. To share with other clients. Answer C. To make informed decisions about the client's progress and treatment plan. This question asks about the importance of data collection in ABA. Data isn't just busywork. It's the objective information we use to see if what we're doing is working. By collecting data on specific behaviors and skills, we can track progress, identify patterns, and determine if the current intervention plan needs to be changed. It helps the supervisor make data-driven decisions, ensuring the client is getting the most effective support. We absolutely would not share client data with other clients. Privacy. Data is our compass in ABA, showing us the way forward. Question 14. Which type of prompting involves physically guiding the client through the entire behavior? A. Gestural prompt. B. Full physical prompt. C. Partial physical prompt. D. Model prompt. Answer B. Full physical prompt. This question asks about different types of prompts. The key phrase, physically guiding the client through the entire behavior, describes a full physical prompt. This is the most intrusive type of physical prompt, where you are helping the client perform the action from start to finish by directly assisting their body movements. A partial physical prompt would involve less help, example, a nudge. A gestural prompt involves pointing or nodding, and a model prompt involves showing the client how to do it. Imagine teaching someone to clap by holding their hands and moving them together. That's a full physical prompt. Question 15. If a client says, "Juice please," because they want juice, this is an example of which type of verbal behavior? A. Tact. B. Mand. C. Intraverbal. D. Etroic. Answer B. Mand. This question asks about verbal behavior, and the critical information is that the client is saying something because they want juice. A mand is a verbal behavior that is controlled by a desire or need, a motivation, and results in getting what is wanted, a specific reinforcement. Saying "juice please" when you are thirsty and want juice is the classic example of a mand. It's not naming something present, tact, having a conversation, intraverbal, or repeating something heard, etroic. Mands are simply requests. Question 16. What is documentation not used for in ABA? A. Tracking client progress. B. Justifying services to insurance companies. C. Planning future sessions. D. Sharing private client information on social media. Answer D. Sharing private client information on social media. This question focuses on the purpose and ethical boundaries of documentation. Documentation is crucial for tracking progress, making treatment decisions, communicating with supervisors, and meeting requirements from funding sources, like insurance. However, client information is highly confidential and must be protected under ethical guidelines and privacy laws, like HIPAA. Sharing it on social media is a severe violation of privacy and ethics. Documentation is for professional purposes related to the client's treatment, never for public sharing. Always remember to protect client privacy. Question 17. When teaching a new skill, breaking it down into smaller, manageable steps is called A. Generalization. B. Maintenance. C. Task analysis. D. Discrimination. Answer C. Task analysis. This question asks about a common strategy for teaching complex skills. When you take a skill that involves multiple steps, like washing hands or tying shoes, and break it down into each individual, smaller step, you are performing a task analysis. This makes learning easier because the client can learn one step at a time or learn to link the steps together. Generalization is doing the skill in new places or with new people. Maintenance is continuing to do the skill over time, and discrimination is telling the difference between things. Task analysis is all about making a big job into a series of small, learnable steps. Question 18. What is the term for a consequence that, when presented immediately following a behavior, causes the future frequency of that behavior to decrease? A. Reinforcement. B. Punishment. C. Extinction. D. Antecedent. Answer B. Punishment. This question asks for the definition of a specific principle of behavior change. The keywords are consequence that, when presented immediately following a behavior, causes the future frequency of that behavior to decrease. This precisely describes punishment. Reinforcement increases future frequency. Extinction decreases future frequency by removing reinforcement, and an antecedent comes before the behavior. Punishment involves adding something unpleasant or removing something pleasant after a behavior to make it less likely to happen again. For example, if a child touches a hot stove, behavior, and feels pain, consequence, they are less likely to touch it again. That's punishment. Question 19. Which dimension of behavior refers to the physical space a behavior occupies or the number of individuals involved in the behavior? A. Frequency. B. Duration. C. Intensity. D. Topography. Answer: D. Topography. This question asks about the different ways we can describe or measure behavior, also known as dimensions of behavior. Topography refers to the form or physical characteristics of the behavior, what it looks like, how it is performed, the movements involved. While the provided options don't perfectly capture the physical space aspect, topography is the term that describes the form of the behavior itself, including the movements, force, and sometimes the location or objects involved. Frequency is count, duration is how long, and intensity is force/magnitude. Topography is about describing what the behavior looks like. For instance, describing a tantrum's topography might include screaming, kicking legs, and hitting the floor. Question 20. When a client stops using a skill because it is no longer reinforced, this is an example of A. Generalization. B. Maintenance. C. Extinction. D. Spontaneous recovery. Answer: C. Extinction. This question describes the outcome of no longer reinforcing a behavior. When a behavior that was previously reinforced no longer receives that reinforcement, its frequency is expected to decrease and eventually stop, or be extinguished. Generalization is using the skill in new ways, maintenance is keeping the skill over time, and spontaneous recovery is the temporary reoccurrence of a behavior after extinction. The scenario here is exactly what happens during extinction. The behavior stops because the payoff is gone. If a child used to get candy for cleaning their room but now doesn't, and they stop cleaning, that's extinction of the cleaning behavior. Question 21. What is a baseline data? A. Data collected after the intervention has been implemented. B. Data collected before the intervention is implemented, showing the natural occurrence of the behavior. C. Data collected only during supervision sessions. D. Data collected on preferred items. Answer: B. Data collected before the intervention is implemented, showing the natural occurrence of the behavior. This question asks about baseline data. Baseline data is like taking a starting picture of the behavior before you start trying to change it. It shows how often, how long, or how intensely the behavior is happening on its own, without the specific intervention in place. This gives you a point of comparison to see if your intervention is actually having an effect. Data collected after the intervention is called intervention data. Baseline data helps you understand the starting point. Question 22. Which ethical principle emphasizes treating clients with dignity and respect? A. Beneficence, doing good. B. Non-maleficence, avoiding harm. C. Respecting autonomy, promoting independence. D. All of the above. Answer: D. All of the above. This question is about core ethical principles in ABA. While respecting autonomy directly relates to promoting independence and making choices, the overall principle of treating clients with dignity and respect is woven throughout all ethical considerations. Beneficence, doing good, means acting in the client's best interest, which includes respecting them. Non-maleficence, avoiding harm, means not only avoiding physical harm, but also emotional or psychological harm, which comes from treating someone disrespectfully. Therefore, treating clients with dignity and respect is fundamental to all ethical principles in ABA. It's about seeing the client as a person first and foremost. Question 23. What does the term antecedent refer to in the ABC model? A. The consequence that follows a behavior. B. The behavior itself. C. What happens immediately before the behavior occurs. D. A preferred item. Answer: C. What happens immediately before the behavior occurs. This question asks about the A in the ABC model. Antecedent behavior consequence. The antecedent is the event, stimulus, or situation that happens right before a behavior occurs. It's like the trigger or the setting event for the behavior. The B is the behavior, and the C is the consequence that follows. Understanding antecedents helps us figure out why behavior might be happening, as they can signal that reinforcement is available for a specific response. For example, the antecedent "mom says, time to clean up" might lead to the behavior "child cries." The antecedent sets the stage for the behavior. Question 24. When a client learns to say dog when they see different types of dogs, big ones, small ones, brown ones, this is an example of A. Discrimination, B. Generalization, C. Maintenance, D. Shaping. Answer: B. Generalization. This question describes generalization, specifically stimulus generalization. Generalization is when a skill or behavior learned in one situation occurs in other similar situations, or when a response is given to stimuli that are similar to the one originally taught. The client learned to say dog for one dog and is now generalizing that response to different kinds of dogs. Discrimination is telling the difference between things, maintenance is keeping the skill, and shaping is gradually building a new behavior. Generalization is about the behavior happening in new, relevant situations. Question 25. Which measurement method involves recording whether a behavior occurred at any point during a specific time interval? A. Frequency, B. Duration, C. Partial interval recording, D. Momentary time sampling. Answer: C. Partial interval recording. This question describes a type of discontinuous measurement. In partial interval recording, you divide the observation time into short intervals, example 1 minute, and simply mark if the behavior happened at any point within that interval. It doesn't matter how many times it occurred or for how long, just that it happened at least once. Frequency counts every instance. Duration measures how long, and momentary time sampling records if the behavior is happening exactly at the end of the interval. Partial interval tends to overestimate the occurrence of behavior, but is useful for behaviors that happen non-continuously. Question 26. What is the ethical responsibility of an RBT regarding client confidentiality? A. Share client information only with family members. B. Discuss client information freely with colleagues for advice. C. Keep all client information private and share only with authorized individuals directly involved in treatment, following privacy laws. D. Post de-identified information online for educational purposes. Answer: C. Keep all client information private and share only with authorized individuals directly involved in treatment, following privacy laws. This question addresses the crucial ethical principle of confidentiality. Client information is private and should only be shared with people who are directly involved in the client's care team and have a professional need to know, and only according to strict privacy laws and company policy. You should not share it with family members not involved in treatment, discuss it casually with colleagues, even for advice, unless following specific protocols, or post it online, even if you think it's de-identified. It's very hard to guarantee anonymity. Protecting confidentiality builds trust and is a legal requirement. Question 27. When teaching imitation, what is the first step? A. Prompting the client to imitate. B. Reinforcing successful imitation. C. Assessing if the client imitates spontaneously. D. Getting the client's attention. Answer: D. Getting the client's attention. This question is about setting up a teaching opportunity, specifically for imitation, but this first step applies to almost any teaching situation. Before you can teach a skill or give an instruction, you need the learner's attention. They need to be looking at you or the materials, ready to respond. Without their attention, any prompt or instruction you give is unlikely to be effective. Once you have their attention, you can then present the model, the behavior you want them to imitate, provide prompts if needed, and reinforce correct responses. Always make sure the learner is ready to learn before starting the teaching trial. Question 28. If a client pulls a toy away from a peer and the peer starts crying, the RBT should first: A. Ignore the behavior. B. Redirect the client to a different activity. C. Consult the behavior intervention plan, BAP, for how to respond. D. Punish the client. Answer: C. Consult the behavior intervention plan, BAP, for how to respond. This question is about your immediate action when a challenging behavior occurs. As an RBT, your response to challenging behavior is guided by the client's behavior intervention plan, BAP. The BAP outlines the specific strategies to use for particular behaviors, including how to react when they happen. You should not guess, ignore it, especially if someone is distressed, or immediately jump to punishment or redirection without knowing the plan. Your first step is always to follow the established procedure in the BAP. If no BAP exists for that behavior, or if the situation is dangerous, your immediate action should be to ensure safety and contact your supervisor. Question 29. Reinforcement provided after a fixed number of responses is called A. Fixed interval, phi, schedule. B. Variable interval, VI, schedule. C. Fixed ratio, FR, schedule. D. Variable ratio, VR, schedule. Answer: C. Fixed ratio, FR, schedule. This question asks about different schedules of reinforcement, specifically one based on the number of responses. A ratio schedule is based on the number of times the behavior occurs, while an interval schedule is based on time. A fixed schedule means the requirement is always the same, so a fixed ratio, FR, schedule delivers reinforcement after a fixed predictable number of responses. For example, an FR3 schedule means the client gets reinforced after exactly 3 correct responses. Fixed interval is reinforcement after a fixed time passes, and variable schedules have unpredictable requirements. Question 30. What is the purpose of delivering reinforcement immediately after a desired behavior occurs? A. To confuse the client. B. To strengthen the connection between the behavior and the consequence. C. To allow the RBT time to think about the next step. D. To prevent the client from engaging in other behaviors. Answer: B. To strengthen the connection between the behavior and the consequence. This question is about the importance of immediacy in reinforcement. When you provide a reinforcer right after a desired behavior, you make it very clear to the learner what behavior earned the reward. This strengthens the association or link between that specific action and the positive outcome, making it more likely that the behavior will happen again in the future. Delays in reinforcement can accidentally reinforce other behaviors that occurred between the target behavior and the reward. Immediate reinforcement makes the learning link strong and clear. Question 31. When documenting a session, you should focus on A. Your personal feelings about the client's progress. B. Objective, observable behaviors and data collected. C. Gossip about the client's family. D. Activities you did that were not in the plan. Answer: B. Objective, observable behaviors and data collected. This question is about proper documentation practices. Your session notes and data should be factual and based on what you actually saw and measured. Objective means unbiased and not based on feelings, and observable means something you can see, hear, or measure. You should document the specific behaviors that occurred, the data you collected, like frequency counts or percentages, the skills you worked on, and the interventions you implemented, all based on the treatment plan. Personal feelings, gossip, or undocumented activities are not appropriate for professional documentation. Stick to the facts and the plan. Question 32. Which measurement method involves recording whether a behavior occurred at the very end of a specific time interval? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Frequency. Answer: C. Momentary time sampling. This question describes another type of discontinuous measurement. In momentary time sampling, you look up exactly at the end of a predetermined interval example every 5 minutes. and record whether the behavior is happening at that precise moment. It doesn't matter if it happened before or after that moment, only if it's happening right then. Partial interval records if it happened at any point, and whole interval records if it happened throughout the entire interval. Momentary time sampling is like taking snapshots of the behavior at specific points in time. Question 33. What is the purpose of a functional assessment? A. To determine the client's IQ score. B. To identify the function or purpose of a challenging behavior. C. To teach the client new academic skills. D. To conduct a preference assessment. Answer: B. To identify the function or purpose of a challenging behavior. This question asks about functional assessment. When a behavior occurs, especially a challenging one, it serves a purpose for the individual. Functional assessment is a process used by supervisors to figure out why the behavior is happening, what the person is getting out of it, the function. Common functions include getting attention, escaping a task, getting a tangible item, like a toy, or sensory stimulation. Knowing the function is crucial because intervention plans are designed to address the function, not just the behavior itself. It's about understanding the behavior's purpose from the client's perspective. Question 34. When teaching a skill, fading a prompt means: A. Gradually providing more assistance. B. Gradually reducing the level of assistance. C. Using the same prompt every time. D. Switching to a different type of prompt. Answer: B. Gradually reducing the level of assistance. This question is about prompt fading. Prompting is giving help, and fading is slowly taking that help away. The goal of fading is to make the client respond correctly without needing the prompt, so they are responding to the natural cue, the instruction or the situation, instead of your hint. This leads to independence. Fading involves gradually reducing the intensity or intrusiveness of the prompt over time as the client becomes more successful. For example, moving from full physical guidance to a light touch, then to a gesture, and finally to no prompt. Fading is like slowly removing the training wheels. Question 35. Which of the following is an example of a naturalistic teaching strategy? A. Sitting at a table and running many trials of a skill in a row. B. Setting up situations during play or daily routines that encourage the client to use a skill. C. Using flashcards to teach new words. D. Conducting a formal assessment in a testing room. Answer: B. Setting up situations during play or daily routines that encourage the client to use a skill. This question asks about naturalistic teaching, unlike highly structured, table-based teaching, often called DTT. Discrete trial training. Naturalistic teaching happens in the client's everyday environment and uses their natural interests and activities as opportunities to teach. It involves setting up the environment or following the child's lead to create chances for them to practice skills in a more typical, fun way. Options A, C, and describe more structured or formal approaches. Naturalistic teaching feels more like guided play or interaction rather than a lesson. Question 36. If you are tracking the amount of time it takes for a client to start a task after you give the instruction, you are measuring: A. Frequency. B. Duration. C. Latency. D. Interresponse time, IRT. Answer: C. Latency. This question asks about different dimensions of behavior measurement. The clue is amount of time it takes for a client to start a task after you give the instruction. This is the definition of latency, the time elapsed between a stimulus, like an instruction or question, and the beginning of the response. Frequency is count, duration is how long the behavior lasts, and IRT is the time between two instances of the same behavior. Latency is the get-going time. For example, if you say clean up and it takes 10 seconds for the child to pick up the first toy, the latency is 10 seconds. Question 37. What should you do if a client's parent asks you for your personal opinion about their child's diagnosis or prognosis? A. Share your opinion honestly. B. Tell them you cannot discuss that and direct them to speak with your supervisor. C. Agree with whatever the parent says. D. Change the subject. Answer B. Tell them you cannot discuss that and direct them to speak with your supervisor. This question relates to the boundaries and scope of practice for an RBT. As an RBT, you are qualified to implement the behavior plan, collect data, and work directly with the client under supervision. You are not qualified to discuss diagnosis, prognosis, the likely course of the condition, or make clinical interpretations. This information comes from the diagnosing professional and your supervisor. It is essential to politely but firmly state that you are not the person to answer that type of question and refer them to the BCBA or other qualified supervisor who can provide that information. Stay within your role. Question 38. Differential reinforcement is a procedure that involves A. Reinforcing only the challenging behavior. B. Reinforcing one behavior while withholding reinforcement for another. C. Punishing all behaviors except the desired one. D. Reinforcing every instance of every behavior. Answer B. Reinforcing one behavior while withholding reinforcement for another. This question asks about differential reinforcement. This is a core strategy in ABA where you strengthen a desired behavior by providing reinforcement for it and weaken an undesired behavior by not providing reinforcement for it, using extinction. You are essentially teaching the client that the desired behavior works to get reinforcement, but the undesired behavior doesn't. There are different types, like DRA, DRI, DRO. But the core idea is reinforcing one behavior differentially compared to another. For example, if a child whines for a toy but gets it only when they ask nicely, you are differentially reinforcing asking nicely while extinguishing whining. Question 39. When should you seek supervision from your BCBA supervisor? A. When you are unsure how to handle a new behavior. B. When the treatment plan doesn't seem to be working. C. When you need guidance on implementing a procedure. D. All of the above. Answer D. All of the above. This question emphasizes the importance of seeking supervision. As an RBT, you work under the close guidance of a supervisor. It is your ethical and professional responsibility to reach out to them whenever you encounter something you're unsure about, notice issues with the plan's effectiveness, need help with procedures, or have any questions regarding the client's treatment. You are not expected to have all the answers or make independent clinical decisions. Regular and timely communication with your supervisor is key to providing effective and ethical services. When in doubt, ask your supervisor. Question 40. If an RBT says moo and the client says moo, this is an example of which type of verbal behavior? A. Tact. B. Mand. C. Intraverbal. D. Echoic. Answer D. Echoic. This question asks about verbal behavior, specifically when the client repeats something they heard. The clue is that the client's response, moo, is the same as the vocal sound the RBT made, moo. This imitation of a vocal sound is called an echoic. A tact is labeling, a mand is requesting, and an intraverbal is like conversational fill in the blank. Echoic behavior is essentially repeating what you hear, like an echo. Question 41. What is the purpose of skill acquisition goals in a behavior plan? A. To decrease challenging behaviors. B. To teach the client new, appropriate skills. C. To identify the function of behavior. D. To measure behavior frequency. Answer. B. To teach the client new, appropriate skills. This question asks about skill acquisition goals. While decreasing challenging behavior is often a key part of a treatment plan, skill acquisition goals specifically focus on teaching the client what to do. This includes teaching communication skills, social skills, daily living skills, academic skills, or play skills. These goals are designed to help the client learn new ways to interact with their environment and achieve desired outcomes. Decreasing challenging behavior, A, is a separate focus and identifying function. C, and measuring behavior. D are tools used in assessment and monitoring, not the goals themselves. Skill acquisition is all about building new positive behaviors. Question 42. When a client is given a break from a difficult task after they complete a portion of it correctly, and this increases the likelihood they will complete more of the task in the future, this is an example of A. Positive reinforcement, B. Negative reinforcement, C. Positive punishment, D. Negative punishment. Answer B. Negative reinforcement. This question describes negative reinforcement. Remember that reinforcement increases the likelihood of a behavior. Negative reinforcement specifically involves the removal or avoidance of something unpleasant, like the difficult task, following a behavior, which then makes that behavior more likely to occur again. The client is reinforced by getting to escape or avoid the task by doing a little work. Positive reinforcement adds something pleasant. Punishment decreases behavior. In this case, getting a break from the task increases the likelihood of doing the task in the future, so it's reinforcement, and it's negative because something is being removed. The task? Question 43. What is the ethical responsibility of an RBT regarding the boundaries of their competence? A. To accept any task assigned by their supervisor, regardless of their training. B. To only perform tasks that they have been trained to do and are within their scope of practice. C. To perform tasks they are unsure about and learn on the job. D. To decline tasks that seem difficult. Answer B. To only perform tasks that they have been trained to do and are within their scope of practice. This question highlights the ethical principle of competence. As an RBT, you have a specific set of skills and knowledge based on your training and certification. It is unethical to perform procedures or tasks that you have not been trained to do or are outside the defined role of an RBT. If your supervisor asks you to do something you're not trained for or believe is outside your scope, you must communicate this and seek training or clarification. You shouldn't just try it or refuse difficult tasks. You should ensure you are competent and authorized to perform the task safely and effectively. Stay within your training and ask for help when needed. Question 44. Which preference assessment method involves presenting items in pairs and seeing which item the client chooses? A. Multiple stimulus without replacement, MSWO. B. Paired stimulus, forced choice. C. Free operant observation. D. Single stimulus, successive choice. Answer B. Paired stimulus, forced choice. This question describes the paired stimulus preference assessment method, also known as forced choice. In this method, you present two items at a time and record which one the client chooses. You go through all possible pairs of items to create a hierarchy of preferences. MS-DO involves presenting multiple items and removing the chosen one. Free operant is watching what the client chooses when everything is available, and single stimulus involves presenting one item at a time. Paired stimulus is unique because it always presents items two at a time. Question 45. What is the term for a decrease in the frequency of a behavior when reinforcement is withheld? A. Recovery. B. Extinction. C. Punishment. D. Spontaneous recovery. Answer B. Extinction. This question asks about the principle where behavior decreases because its reinforcement is stopped. As we discussed before, extinction is exactly this process. When a behavior no longer gets the payoff it used to, it becomes less likely to happen. Recovery isn't a standard ABA term here. Punishment decreases behavior by adding an aversive or removing a reinforcer, not just withholding the usual reinforcer. And spontaneous recovery is the temporary reappearance of an extinguished behavior. Extinction is the process of the behavior fading away due to lack of reinforcement. Question 46. When conducting discrete trial training, DTT, what is the typical order of the three-term contingency? A BC. A. Behavior, greater than antecedent greater than consequence. B. Consequence greater than behavior greater than antecedent. C. Antecedent greater than behavior greater than consequence. D. Behavior greater than consequence greater than antecedent. Answer C. Antecedent greater than behavior greater than consequence. This question asks about the basic unit of analysis in behavior analysis, the three-term contingency, especially as it's used in structured teaching like DTT. The order is always antecedent, what happens before, followed by the behavior, the client's response, followed by the consequence, what happens immediately after the behavior. You present the instruction or stimulus. A. The client performs a behavior. B. And then you provide a consequence, like reinforcement or correction. C. Understanding this ABC order is fundamental to ABA. Question 47. What is the primary reason for using reinforcement with clients? A. To make the client happy. B. To increase the future likelihood of a desired behavior. C. To stop challenging behaviors immediately. D. To bribe the client. Answer B. To increase the future likelihood of a desired behavior. This question gets at the core purpose of reinforcement in ABA. While a client might feel happy when they are reinforced, the technical purpose of reinforcement is its effect on future behavior. By delivering reinforcement immediately after a behavior, we make that behavior more likely to happen again in similar situations. It's a teaching tool to strengthen desired actions. It's not primarily about immediate behavior stop. That's more related to consequence-based strategies for reduction or bribing, which implies giving the reward before the behavior or for undesired behavior. Reinforcement is a principle used to build helpful behaviors. Question 48. When implementing a behavior reduction plan, you should focus on A. Punishing the client every time they engage in the challenging behavior. B. Only using extinction to reduce the behavior. C. Implementing the procedures exactly as written in the behavior intervention plan, BIP. D. Figuring out your own consequences for the behavior. Answer C. Implementing the procedures exactly as written in the behavior intervention plan, BIP. This question is about your role in behavior reduction. Behavior reduction plans are complex and must be followed precisely as designed by your supervisor in the BIP. The BIP will specify exactly what antecedents to manage, what behaviors to track, and what consequences, including differential reinforcement or extinction procedures. To implement, you should not make up your own strategies, D, or rely solely on punishment, which may or may not be in the plan and is only one tool, or extinction alone, unless that's what the plan says. Your job is faithful implementation of the written plan. Question 49. Which type of data collection is best suited for measuring behaviors that happen continuously for a period of time, like humming or rocking? A. Frequency. B. Duration. C. Partial interval recording. D. Latency. Answer B. Duration. This question asks about measuring behaviors that continue over time. Duration measurement involves recording how long each instance of a behavior lasts from start to finish. Behaviors like humming, rocking, staying on task, or crying are good candidates for duration recording because how long they happen is often the most important aspect. Frequency counts how many times, partial interval records if it happens at all in an interval, and latency measures the time to start. For behaviors that last, duration is usually the most informative measure. Question 50. When a client points to a dog and says, "Doggy," this is an example of which type of verbal behavior? A. Tact. B. Manned. C. Intraverbal. D. Echoic. Answer A. Tact. This question asks about verbal behavior. The client is seeing a dog and labeling it doggy. This response is controlled by the nonverbal stimulus, the sight of the dog, This is the definition of a tact, labeling something present in the environment. It's not a request, mandi, a conversation, intraverbal, or repeating something heard, etoisi. Pointing often accompanies a tact, but the key is labeling the observed item. Question 51. What is the primary ethical concern when collecting data on a client's behavior? A. Making sure the data looks good. B. Accuracy and integrity of the data. C. Finishing data collection quickly. D. Using the data to gossip with coworkers. Answer B. Accuracy and integrity of the data. This question focuses on the ethical responsibility related to data. The data you collect is the basis for making important decisions about a client's treatment. Therefore, it is ethically crucial that the data is collected accurately and honestly. Integrity. Inaccurate data can lead to incorrect decisions that harm the client's progress. Your goal isn't to make the data look a certain way. A. Finish fast. C. Or misuse it. D. Your primary ethical duty with data is to ensure it is a true and honest reflection of what happened. Question 52. Which teaching procedure involves gradually changing the prompt from a more intrusive one to a less intrusive one? A. Prompt dependency. B. Stimulus fading. C. Prompt fading. D. Shaping. Answer C. Prompt fading. This question asks about gradually reducing assistance, which is the definition of prompt fading. As we discussed earlier, prompt fading systematically decreases the level of prompting to encourage the learner to respond independently. Prompt dependency, A, is an undesirable outcome where the client only responds when prompted. Stimulus fading, B, is gradually changing the stimulus itself, like making a picture less boldy. Shaping, D, is reinforcing closer and closer approximations to a desired behavior. Prompt fading is specifically about reducing the help you are giving. Question 53. What is the term for a temporary increase in the frequency, intensity, or duration of a behavior that occurs when an extinction procedure is first implemented? A. Generalization. B. Spontaneous recovery. C. Extinction burst. D. Punishment effect. Answer C. Extinction burst. This question describes a common phenomenon that happens when you start using extinction. When a behavior no longer gets the reinforcement it's used to, the individual often tries harder or in different ways to get that reinforcement before giving up. This temporary increase in the behavior is called an extinction burst. It can be challenging, but often indicates that the extinction procedure is having an effect. Generalization and spontaneous recovery are different concepts, and punishment is a different procedure entirely. An extinction burst is like the behavior's last attempt to get the payoff it expects. Question 54. What does the term generalization mean in ABA? A. The client learns a new skill. B. The client uses a skill in different ways, places, or with different people. C. The client stops using a skill. D. The client only uses a skill with the person who taught it. Answer B. The client uses a skill in different ways, places, or with different people. This question asks about generalization, which is a critical goal in ABA. We don't want clients to only perform skills in the therapy room with their RBT. We want them to use those skills where and when it's natural in their life. Generalization is when a learned behavior occurs in new situations or with new stimuli, like responding to different people in different rooms or using slightly different words or objects. Option describes the opposite, prompt or stimulus dependency. Generalization means the learning is spreading beyond the initial teaching conditions. Question 55. If you are tracking the total amount of time a client spends crying during a 30-minute session, you are measuring A. Frequency. B. Duration. C. Latency. D. Interresponse time. IRT. Answer B. Duration. This question is asking about measurement again. The key phrase is total amount of time a client spends crying. This indicates you are measuring how long the behavior, crying, lasts. Duration is used for behaviors that occur for an extended period. Frequency would be how many times they cried. Latency would be the time until they started crying after a cue, and IRT would be the time between different crying episodes. For measuring how long a behavior happens, duration is the correct choice. Question 56. An RBT is working with a client who frequently throws toys. The supervisor has identified that the function of this behavior is to get attention. Which intervention strategy is most likely to be effective based on this function? A. Giving the client the toy back immediately when they throw it. B. Ignoring the toy throwing, extinction, and reinforcing appropriate play with toys. Differential reinforcement. C. Putting the client in timeout every time they throw a toy. D. Giving the client more toys to throw. Answer B. Ignoring the toy throwing, extinction, and reinforcing appropriate play with toys. Differential reinforcement. This question connects understanding the function of behavior to choosing an intervention. If the function is attention, the behavior, throwing toys, is happening because it previously resulted in attention. To decrease this behavior, you need to stop providing the reinforcement, attention, for throwing, extinction. Simultaneously, you need to teach and reinforce a more appropriate way for the client to get attention or engage with toys. This is differential reinforcement. Giving the toy back, A, might reinforce throwing. Timeout, C, is punishment, and its effectiveness depends on the function and how it's implemented, but it's not directly addressing the attention function by teaching a replacement. Giving more toys, D, might even increase the opportunity to throw. Addressing the function with extinction and differential reinforcement is key. Question 57. When a client spontaneously uses a skill they were taught in a new setting without direct teaching, this is an example of A. Maintenance, B. Discrimination, C. Generalization, D. Prompting. Answer C. Generalization. This question again describes generalization. The words spontaneously uses a skill in a new setting without direct teaching are the hallmarks of generalization. The client is applying what they learned to a different place or situation than where it was originally taught. Maintenance is doing the skill over time, discrimination is telling things apart, and prompting is giving help. Generalization shows that the learning is truly functional and spreading to other parts of the client's life. Question 58. Which term refers to the consistency of measurement, meaning the data taken is reliable? A. Validity, B. Accuracy, C. Reliability, D. Reactivity. Answer C. Reliability. This question asks about the quality of data measurement. Reliability in data collection means that if you or someone else measured the same behavior under the same conditions, you would get similar results. It refers to the consistency and stability of the measurement. Validity is whether you are measuring what you intend to measure. Accuracy is whether the measurement reflects the true value, and reactivity is when the client's behavior changes because they know they are being observed. Reliability is about getting consistent measurements. Question 59. What is the minimum amount of supervision an RBT must receive per month? A. 1 hour. B. 5% of the hours spent providing behavior analytics services. C. 10% of the hours spent providing behavior analytics services. D. 20 hours. Answer B. 5% of the hours spent providing behavior analytics services. This question asks about the specific supervision requirements for RBTs set by the Behavior Analyst Certification Board, BHB. RBTs are required to receive supervision for at least 5% of the hours they spend providing behavior analytics services per month. This supervision must include at least 2 face-to-face meetings. This requirement ensures RBTs receive ongoing guidance and support from a qualified supervisor. Knowing the 5% rule is important for understanding your responsibilities and ensuring you are receiving adequate oversight. Question 60. If an RBT says point to red and the client points to the color red, the RBT should immediately A. Say no, try again. B. Provide reinforcement. C. Provide a prompt. D. Ignore the response. Answer. B. Provide reinforcement. This question describes a scenario where the client makes a correct response to an instruction. In ABA, when teaching new skills, it's crucial to reinforce correct responses immediately. Providing reinforcement right after the client points to red strengthens the likelihood they will point to red again when given the instruction. Saying no, A, is a correction. Prompting, C, happens before the response to make it more likely, and ignoring. D would be appropriate for an incorrect response or during extinction, but not a correct one. Reinforcement for correct responses is key to learning. Question 61. What is the main difference between positive and negative reinforcement? A. Positive reinforcement increases behavior. Negative reinforcement decreases behavior. B. Positive reinforcement adds something pleasant. Negative reinforcement removes something unpleasant. Both increase behavior. C. Positive reinforcement is good. Negative reinforcement is bad. D. Positive reinforcement involves food. Negative reinforcement involves breaks. Answer. B. Positive reinforcement adds something pleasant. Negative reinforcement removes something unpleasant. Both increase behavior. This question clarifies the distinction between positive and negative reinforcement. The critical point is that both positive and negative reinforcement increase the future frequency of the behavior they follow. The difference lies in how the reinforcement is delivered. Positive reinforcement involves adding something desirable, like praise, a sticker, while negative reinforcement involves removing or avoiding something undesirable, like escaping a task, stopping an annoying noise. Option is incorrect because both increase behavior. Option C is a common misconception. Negative doesn't mean bad. Option gives examples but isn't the core difference. Remember, positive means adding, negative means removing, and reinforcement always means the behavior increases. Question 62. When should you document information about a client session? A. At the end of the week. B. As soon as possible after the session or as data is collected. C. Only if something unusual happened. D. Only when your supervisor reminds you. Answer. B. As soon as possible after the session or as data is collected. This question is about timely and accurate documentation. It is crucial to document your sessions and collect data in a timely manner, ideally immediately after the behavior occurs or the session ends. This ensures the information is accurate and fresh in your mind, reducing errors. Waiting too long can lead to forgetting details or inaccuracies. Documentation is a regular part of your job, not just for unusual events or when reminded. Good documentation is done promptly. Question 63. What is the term for a consequence that involves removing a desirable stimulus following a behavior, resulting in a decrease in the future frequency of that behavior? A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer. D. Negative punishment. This question asks about a type of punishment procedure. Remember that punishment decreases behavior. Negative punishment involves removing something pleasant or desired after a behavior occurs, which makes that behavior less likely in the future. For example, taking away a toy, removing a desirable stimulus. When a child hits a sibling, behavior to make hitting less likely is negative punishment. Positive punishment adds something aversive. Reinforcement increases behavior. Negative punishment is taking away something good to decrease a behavior. Question 64. When teaching a client to identify objects, you hold up a picture of a car and ask, "What is it?" The client says, "Car." This is primarily targeting which verbal behavior? A. Manned. B. Tact. C. Intraverbal. D. Listener responding. Answer: B. Tact. This question asks about verbal behavior elicited by seeing something. The stimulus is the picture of the car, nonverbal, and the client is labeling it car. This is the definition of a tact. While you are asking a question, what is it? The client's answer is controlled by seeing the object, not by the verbal question itself, which would be an intraverbal if they couldn't see the picture. Mand is asking for something, and listener responding is following directions, saying the name of something you see is a tact. Question 65. Which ethical guideline requires RBTs to avoid conflicts of interest and not accept gifts of significant value from clients or their families? A. Responsibility to clients. B. Responsibility to supervisees. C. Responsibility to colleagues. D. Responsibility to the BACB. Answer: A. Responsibility to clients. This question relates to ethical standards concerning relationships with clients and avoiding situations that could compromise your professional judgment or exploit the client. The guideline about avoiding conflicts of interest and not accepting gifts of significant value falls under the RBT's ethical responsibility to their clients. Accepting gifts can create a sense of obligation or blur professional boundaries. Your focus should always remain on the client's best interest, free from potential conflicts arising from personal gain. Question 66. What is the term for the skill of telling the difference between two or more stimuli? A. Generalization. B. Maintenance. C. Discrimination. D. Shaping. Answer: C. Discrimination. This question asks about the ability to respond differently to different cues or stimuli. Discrimination is the opposite of generalization. It's about learning to respond or not respond based on the specific features of the situation or stimulus. For example, if a client learns to say apple only when they see an apple and not when they see a banana, they have discriminated between the two fruits. Generalization is responding similarly to different stimuli. Maintenance is keeping a skill, and shaping is building a new behavior. Discrimination is about recognizing differences and responding accordingly. Question 67. If you are tracking the time between one instance of a client hitting their head and the next instance of the client hitting their head, you are measuring A. Duration. B. Latency. C. Interresponse time, IRT. D. Frequency. Answer: C. Interresponse time, IRT. This question asks about measuring the time between occurrences of the same behavior. IRT is specifically defined as the time elapsed between the end of one instance of a behavior and the beginning of the next instance of the same behavior. Duration is how long a single behavior lasts. Latency is the time from a stimulus to the start of the behavior. Frequency is just the count. IRT gives you information about how spaced out the behavior is. Question 68. What is the purpose of collecting IOA? Inter-observer agreement data. A. To see if the client likes the RBT. B. To check the reliability, consistency of the data being collected. C. To compare the client's data to other clients. D. To determine the function of a behavior. Answer: B. To check the reliability, consistency of the data being collected. This question asks about IOA. IOA involves having two independent observers collect data on the same behavior at the same time, and then comparing their data to see how closely they match. A high percentage of agreement indicates that the data collection method is reliable and that different people are measuring the behavior in a consistent way. This increases confidence in the data's accuracy. IOA is a quality control measure for the data collection itself. Question 69. When is it acceptable for an RBT to use physical restraint with a client? A. Whenever the RBT feels unsafe. B. Only if it is part of a written, supervisor-approved behavior intervention plan to ensure safety. C. To prevent the client from accessing preferred items. D. Never. RBTs are not allowed to use physical restraint. Answer. B. Only if it is part of a written, supervisor-approved behavior intervention plan to ensure safety. This question addresses a serious topic with strict ethical and safety guidelines. Physical restraint is a restrictive procedure and should only be used as a last resort when necessary to prevent serious harm to the client or others, and only if it is explicitly outlined as a procedure in the client's written, supervisor-approved behavior intervention plan based on a thorough assessment. RBTs cannot decide to use restraint on their own. A. Use it to manage access to items. C. Or assume it's never allowed. D. As some specific, safety-based plans may include it with appropriate training. Always follow the written plan and supervisor instruction regarding any restrictive procedure like restraint. Safety is paramount. Question 70. What is an essential component of a written skill acquisition plan? A. A list of all the client's challenging behaviors. B. A definition of the skill being taught and the teaching procedures. C. The RBT's schedule for the week. D. A summary of the client's medical history. Answer. B. A definition of the skill being taught and the teaching procedures. This question asks about the components of a plan for teaching new skills. A skill acquisition plan needs to clearly define what skill is being taught, the target behavior, and provide step-by-step instructions on how to teach it. The procedures, including prompts, reinforcement schedule, criteria for mastery, etc. While challenging behaviors, A, are important, they are covered in a BIP. Schedules, C, and medical history. D are important logistical or background details, but are not the core components of the teaching plan itself. The plan must tell you exactly what to teach and how to teach it. Question 71. If a client engages in screaming behavior that is maintained by escaping a task, you should A. Allow the client to escape the task when they scream. B. Remove the client from the task and reinforce them for screaming. C. Follow the behavior intervention plan, which likely involves preventing escape for screaming, extinction, and teaching an alternative way to ask for a break, differential reinforcement. D. Ignore the client and give them a preferred item. Answer. C. Follow the behavior intervention plan, which likely involves preventing escape for screaming, extinction, and teaching an alternative way to ask for a break, differential reinforcement. This question again connects function to intervention. If screaming's function is escape, it means screaming works for the client to get out of something they don't want to do. To reduce screaming, you must stop letting it work. Extinction of escape-maintained behavior. This means not allowing the client to escape the task when they scream. However, you must also teach them a better way to get a break or indicate they need help. Example, saying, "Break, please," using a picture card. This is differential reinforcement. Always follow the BIP for specific steps, but the general principle is to stop the behavior from working for the client while teaching them a functional replacement. Question 72. Which schedule of reinforcement typically produces a high, steady rate of responding? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer. B. Variable ratio, VR. This question asks about the characteristic response patterns associated with different reinforcement schedules. Variable ratio, VR, schedules where reinforcement is delivered after an unpredictable average number of responses, like slot machines, produce high and steady rates of behavior because the client never knows which response will be the reinforced one, so they keep trying. Fixed ratio, FR, produces high rates but with pauses after reinforcement. Interval schedules, Phi, VI, which are based on time, typically produce lower rates than ratio schedules. Think of a gambler at a slot machine. They pull that lever over and over because they know on average it pays out, even if they don't know exactly when. VR. Question 73. When assisting with a functional assessment, an RBT's role is primarily to A. Determine the function of the behavior. B. Design the assessment procedures. C. Collect data on the behavior and surrounding events. ABC data, as directed by the supervisor. D. Interview the client about why they engage in the behavior. Answer: C. Collect data on the behavior and surrounding events. ABC data, as directed by the supervisor. This question asks about the RBT's specific contribution to the functional assessment process. While supervisors analyze the data and determine the function, A, and design the assessment, B, the RBT's crucial role is collecting the detailed objective data needed for that analysis. This often involves taking ABC data, recording the antecedent, behavior, and consequence, exactly as instructed by the supervisor. RBTs do not typically interview clients. D, for formal functional assessment purposes. That is a supervisor role. Your job is to be the accurate data collector on the front lines. Question 74. What is the purpose of a visual support, such as a picture schedule, for a client? A, to keep the client busy. B, to help the client understand expectations and transitions. C, to replace verbal instructions entirely. D, to test the client's ability to recognize pictures. Answer: B, to help the client understand expectations and transitions. This question is about visual supports. Visuals like picture schedules, first/then boards, or visual timers are used to provide clear information to the client in a way they can easily understand. They help make routines predictable, show what will happen next, and ease transitions between activities. This reduces anxiety and can promote independence. They are not just for keeping busy. A, they don't necessarily replace all verbal instructions. C, and while they involve picture recognition, their primary purpose is communication and structure, not testing. D, visual supports are powerful tools for clear communication and predictability. Question 75. What should you do if you are asked to implement a procedure that you believe is harmful or unethical? A, implement the procedure anyway, following your supervisor's instruction. B, discuss your concerns with your supervisor and refuse to implement it if the concerns are not resolved or you are instructed to proceed against ethical guidelines. C, report your supervisor to the BACB immediately without discussing it with them. D, quit your job. Answer: B, discuss your concerns with your supervisor and refuse to implement it if the concerns are not resolved or you are instructed to proceed against ethical guidelines. This question addresses a critical ethical dilemma. You have an ethical obligation to follow your supervisor's instructions, but you also have an ethical obligation to protect the client and adhere to the RBT ethics code. If you believe a procedure is harmful or unethical, your first step is to voice your concerns clearly and professionally with your supervisor. Document this communication. If the supervisor addresses your concerns satisfactorily and the procedure is deemed ethical and appropriate, you should proceed. However, if your concerns are not resolved, or you are directed to do something that violates ethical standards, you must refuse to implement it and report your concerns to the appropriate authority, like the BACB. According to ethical guidelines and company policy, quitting D might be necessary in extreme cases, but it's not the first step. Blindly following unethical instructions, A, is never acceptable. Reporting without prior discussion, C, might not be the required first step unless immediate danger is present and discussion is not possible. Your ethical code empowers you to speak up and protect clients.